Okay, Understanding Emergency Codes by Alana Diochand.
And Christina Bafaltos.
So, emergency codes at Thunder Bay Regional Health Science Centers. Students and nurses are expected to familiarize themselves with the emergency code systems, including their definitions and how to respond to the code. It's their responsibility to know what the procedures are for their units that they're working on, and they must the most current information for the emergency codes are located on the intranet. So got a little okay. Code red, which means fire. Nurses and nursing students and any staff can respond to a code red or initiate a code red. It's important to remain calm and follow the acronym REACT. So, remove persons from the immediate danger, ensure that the doors are closed to confine the smoke and the fire, activate the fire alarm, and then call the switchboard by dialing 55 to confirm the fire location and to call the code. And then, lastly, try to extinguish the fire or continue to evacuate. Next, nursing staff should locate a safety vest and then follow the instructions for their departmental subplan. And it's important to not use the elevators during a code red. For a code orange, which is external disaster, there's level 1 and level 2. The difference between the levels is whether or not the emergency department can handle the number of patients coming in from the disaster. Both are initiated by senior management, in which case they would call 55 and then indicate that there's a code orange and the level of the code. For nursing staff, it's important for them to, if they're in the emergency department, remain in their department for further information and task, or if they're on a different unit, to either prepare to accept patients from the emergency department by either facilitating discharge or preparing information for families in waiting areas in the cafeteria. And nursing staff will be informed of whether or not to initiate fan-outs for this code.
So code yellow stands for missing person for anyone who's 16 years and older, initiated by any staff who is aware that the patient is missing. Before initiating the code, you must do a preliminary search for departments, adjacent areas, and all areas. So you dial 55 to notify switchboard to request the patient to be back to unit. So there are two different kinds, code yellow check and code yellow search. Code yellow check, you do hospital-wide response, and code yellow search, this is initiated for patients considered high risk. As a nurse's responsibility, you must know the individual's risk status, such as cognitive impairment and other conditions and circumstances. Procedures for high-risk patients. After conducting a preliminary search, you review the high-risk patient assessment. If whereabouts are still unknown and there is an immediate threat to the patient, dial the switchboard. And for the non-high-risk patient, you just, as a nurse, you document actions and details in the patient's chart and do not activate code yellow search. So code amber is for missing person for anyone who's 15 years and younger. Again, initiated by any staff who is aware that the patient is missing. Applies to both patient and non-patient infants and children. There are three kinds, code amber search, code amber stand down, code amber check. And as part of the search team, you must know which areas you're responsible to search, know which exits are being monitored, because when the code is activated, the only available exits are the main entrance or the emergency waiting room entrance. If the child is still missing, you must direct the parents or guardians to information desk. And if you suspect there's an abduction, there's a policy to follow. And when the child is found, you must approach the child in a supportive manner, notify the switchboard immediately, and escort the child to reunite with the family.
So code green is evacuation. There's two levels to this code: precautionary evacuations and stat immediate evacuations. Precautionary is initiated by senior staff, and stat immediate is initiated by any staff with knowledge of an incident. So nursing staff can respond to these or initiate these by dialing 55. You state the code green and location to evacuate to. So for nursing staff and nursing students, listen to the overhead announcements for details of the evacuation location. one staff member from every clinical department is to report the location of the code green stat and provide help. Immediately, nursing staff should also immediately remove all people from the danger, check the washroom storage areas and hallways in the immediate area, and nursing staff should flag rooms once they are cleared. For a code blue, which is adult cardiac arrest, so anyone over the age of 16, trained nursing staff will initiate compressions until relieved by the cardiac response team. The nursing staff will also retrieve the airway box and ensure it is available for the cardiac response team. Nursing staff will also assist the cardiac response team as directed. Nurses that are not involved with the resurrection measures will care for the patients of the staff that are assisting with the code blue. Nurses will also ensure that the patient's chart and medication administration records are brought to the location of the cardiac arrest. So nurses can call a code blue by completing the following steps. So dial 55, state the code blue, and then state the location and room number. For a code stroke, only nurses and physicians can initiate a code stroke. And this is done when the patient meets the criteria, which suggest criteria that suggest that there's an onset acute stroke. This is unilateral arm, leg weakness or drift, unilateral facial droop. The patient will present with slurred speech, difficulty expressing words, having difficulty word finding or understanding speech. Nurses will assist with the last known well time. This is the time when the patient was last known to be without signs and symptoms of the current stroke. To do this, to initiate a code stroke, you dial 55, state code stroke, state the location, and state the room number. For code pink, this is a pediatric cardiac arrest, and a code NRP, this is a neonatal cardiac arrest. Nurses will respond the same way with helping with compressions or initiating compressions, patient chart information, medication administration records, and they'll also assist the cardiac team or relieve nurses who are helping with the resurrection. The difference between a code pink and a code NRP is the age. So code pink is over 1 month of age up to 16 years, and a code NRP is within 1 month of age, and any staff or nurse can initiate it when noticing an unresponsive child who is in need of emergency medical interventions.
And code purple stands for hostage. So only the police are the primary responders. Any hospital staff will not involved to assist as a safety precaution. Remember the Code purple stands for hostage. Police are the primary responders. Any staff, hospital staff, will not involved to assist as a safety precaution. Remember, calm, evacuate, and hide. So in a situation, you must remain calm and evacuate. For safety, clear anyone in the hallways. Do not make attempt to return to your department. If you're unable to evacuate, hide. And you call 911 directly, so you provide as much details as possible. And code black is a bomb threat. This applies to any written or verbal threats. If you must take this seriously and consider genuine until proven otherwise. If you come across a mysterious package, do not attempt to move or inspect it. Do not call the switchboard to report inspection results. Instead, call the forensics security office. This can be only initiated by a senior leader. When you're searching for the package, you do this in two-person teams. You do systematic search and refer to your departmental subplans. Code white stands for violent and threatening person. You must always know that if the threat overruns hospital internal capacity, call the police, dial 9-911. Code white responders are a minimum of 2 security guards and 1 staff. Code white team leader will direct the response, and responders will only carry out duties within their scope of practice. Team leader, this can be a nurse, should have an established therapeutic rapport with violent or threatening person. If the violent person is non-patient, the most senior security guard assumes the role. To reiterate the responsibility of code white team leader, such as a nurse, you must identify yourself. You direct the overall response, terminate the code, and ensure that the documentation is completed. And to note, restraints and seclusions are only used as a last resort, and there's a policy to follow.
And then this is the reference page.